All right, it is 10 a.m., so we are going to go ahead and get started. Good morning and welcome to the DSCC webinar for electronic visit verification, known as EVV. My name is Kelly Wyman. I'm Assistant Manager for the Home Care Quality Improvement Team here at DSCC. I'm also joined today by Colby Ward, Director of Client Success, and Heather Spielman, Client Success Manager of HHAeXchange, along with some of our colleagues from the Illinois Department of Healthcare and Family Services. Before we continue, please put a comment in the chat if you're having any technical difficulties seeing my presentation. We appreciate you dedicating time to attend today's webinar. We believe it will support your agency work toward compliance with EVV as we approach the halfway mark to reach 50% compliance by or before April 30th of 2025. This webinar will be recorded for later review, and we will be monitoring questions in the chat. Questions not covered in today's presentation or via a comment back to you in the chat will be answered via an FAQ that will be sent out with the presentation recording and slides. DSCC operates the home care program on behalf of the Illinois Department of Healthcare and Family Services, HFS. The program is the single point of entry for Illinois children in need of in-home shift nursing. We currently serve over 1,600 participants and their families. Our home care quality improvement team monitors program compliance to ensure we uphold federal and state requirements and provide high quality services to our families via our approved nursing agencies. We are proud of our program's quality. On our recent survey, 96.8% of respondents reported being treated well by agency nursing staff in their home. I wanted to share this number with you because your agencies all play an incredibly important role in supporting our families. And I think you should also be incredibly proud of that quality piece. DSCC quality assurance also includes federal financial accountability requirements. Today's webinar is intended to support our nursing agencies succeed, meeting EVV compliance standards. All DSCC agencies should be well aware of EVV. But as a quick recap of what was already presented at our webinar in August, EVV electronically verifies home health care visits funded by Medicaid, is mandated by the federal CMS under the 21st Century Cures Act. EVV works by using GPS to electronically capture times, location, and attendance for program integrity monitoring. Additional info and resources are available at the links listed on this slide, all of which have been previously shared with our agencies. You can also find information on the EVV Information and Resources page of the DSCC website, and that's under the Home Care Information and Resources for Providers section. DSCC began monitoring and enforcing compliance thresholds as mandated by updated HFS policy effective October 31st, 2024. For nursing agencies who do not reach 50% compliance by or before the 6-month deadline of April 30th of this year, they will be required to complete a remediation plan due within 30 days of the formal noncompliance notification that you'll receive from DSCC. For nursing agencies who do not reach 75% compliance by or before the 1-year mark of October 31st of this year, they will be required to complete a formal corrective action plan. If the agency doesn't reach 75% compliance rate by 90 days after that formal noncompliance notification, DSCC will place the agency on hold, as well as notify HFS, as well as the Office of the Inspector General, OIG, who monitors Medicaid fraud, waste, and abuse. Our goal at DSCC is to support agencies to avoid as many remediation and corrective plans as possible while upholding federal financial accountability. Our role is to provide information on the process and expectations for successful EVV implementation and compliance to all agencies. This includes connecting agencies to resources for support, such as handouts, tip sheets, hotline numbers, tips for success, and links to webinars and town halls. DSCC is also creating resources like this webinar to support agency-specific EVV success. As we approach critical threshold deadlines, DSCC will monitor compliance and oversee required remediation and corrective action plans. As we go, DSCC is gathering and analyzing data via agency input, and reporting to better understand compliance progress barriers. We present systemic concerns to HHAeXchange and HFS leadership via email, as well as during biweekly meetings for problem solving. DSCC can assist with compliance requirement questions. We can also elevate concerns not resolved in a timely or responsive manner if needed. DSCC cannot provide direct technical support for EBV. That's the role of HHAeXchange and, if applicable, any third-party vendor your agency chooses to work with. Ultimately, agencies are accountable for meeting key compliance deadlines and maintaining ongoing compliance as defined in HFS and DSCC policy. For their role, agencies need to engage by reviewing HFS provider notices and DSCC liaison emails for updates, reading and following DSCC's EBV compliance policy, maintaining their own internal EBV policy specific to their agency, and providing EBV training to their staff. Agencies are accountable for monitoring their own compliance percentage and identifying and addressing factors that may negatively impact compliance, including individual staff noncompliance, in order to avoid consequences like remediation and corrective action plans, or being placed on hold or reported to OIG. Agencies are also responsible for troubleshooting technical issues. This may include seeking HHAeXchange technical support through the portal or via the dedicated Illinois phone line listed on this slide. Agencies voluntarily choosing to use a third-party vendor to electronically transfer their EBV data are responsible for navigating issues stemming from their third-party data transmission. If unable to transmit data by last September 30th, agencies were required by HFS to use HHAeXchange directly for EBV until third-party data transmission was achieved. If prolonged efforts to resolve issues through HHAeXchange are unsuccessful, agencies may reach out to DSCC. As with other communication to your liaison, email and phone via your assigned liaison are preferred. However, support requests to DSCC must include evidence of attempts to troubleshoot first. This means providing a full description of the issue, the date it began, dates of multiple attempts to access support, as well as the method, the hotline, or the support ticket system, support ticket numbers relevant to the issue, and evidence of agency responsiveness and cooperation with HHAeXchange support staff. DSCC will not elevate any further concerns without those in place. Nursing agencies must monitor the EBV compliance of all staff, RNs, LPNs, or CNAs, including paid parent caregivers, providing services to DSCC participants. Provider visits must capture all the following required elements to be considered EBV compliant: point in time completion that has not been manually entered or adjusted, correct date and type of service, RN, LPN, or CNA, the correct individual receiving the services as identified by their correct name and Medicaid RIN number. You'll see that referred to as the member ID in the HHA portal. And as a reminder, the Medicaid RIN is always available at the top of the nursing hours approval or 2352 form. The correct shift begin and end time, the location of service delivery within 500 feet of GPS range, and the correct individual providing the service as identified by their 9-digit Social Security number. A few requirements do not apply to DSCC agencies. First, because the DSCC claims unit verifies all submitted billing against the nursing hours prior authorization, known as the 2352, there is no need to enter service authorization into the HHAeXchange portal for our DSCC participants. If you're directed to do so during a support request, please contact your liaison. Second, you're not required to complete scheduling in the system. Agencies are free to use whatever scheduling system they want, and that does not impact your compliance percentage. Additionally, agencies do not need to worry about shift rounding impacting their compliance. HHAeXchange has logic in place to ensure clock ins and outs match build time in accordance with DSCC billing units per our claim sheet directions. For instance, a clock out at 7:07 a.m. will round down to 7 a.m. to match the claim units that you submit, while a shift ending at 7:08 a.m. will round up to 7:15 a.m. on your claims units. Shifts are also automatically split at midnight to correlate with billing requirements. Just like all Illinois providers, DSCC agency's EBV data needs to meet the general compliance criteria reviewed earlier in the presentation. Additionally, all modifiers must match the claim submission. For example, paid parent caregivers are not exempt from EBV and must always have the required U7 modifier listed. The home care program is a home and community-based service. Compliance concerns should not jeopardize those community services. In the case of routine community settings for services, such as a school or the secondary home, in the case of split custody, agencies should add additional addresses for the participant where those services are provided. For less routine locations, like a family outing to the zoo, the community setting feature should be used. Agencies are responsible for monitoring the community setting feature is used appropriately, and suspiciously high usage of this feature will be investigated for Medicaid fraud, waste, and abuse. As a reminder, unless the paid caregiver is the participant's direct family member, the paid caregiver's home is never an acceptable location because it is not part of the participant's community. Agencies choosing to use a third-party provider are responsible for ensuring their data transmits appropriately. This may require working with the chosen provider that you're working with and/or submitting an EDI ticket to HHAeXchange for support and collaboration. Agencies are also responsible for signing an attestation they've read and understand DSCC's EBV policy annually at time of reapproval. Likewise, agencies must maintain their own EBV policy on file to ensure caregiver compliance. DSCC will verify this policy during annual audits. Most importantly, agencies must provide sufficient training for staff serving DSCC participants to ensure they maintain at or above the acceptable compliance threshold. Finally, all DSCC agencies must remain active, correct impact enrollment to ensure EBV data appropriately links up to compliance monitoring completed by HFS and DSCC. All DSCC agencies are required to maintain a valid active 400 license and update their expiration date and impact upon renewal. Likewise, business status expiration must also have an updated renewal and documented expiration date and impact. All agencies must have an NPI with an impact, and each agency branch with differing NPIs must have a separate impact enrollment. Revalidation occurs on a rolling basis and must be completed to avoid a gap in payment. DSCC has an impact tip sheet and several other resources located on our website at the links on this slide, which will be sent out after the presentation. For nursing agencies who do not reach a compliance rate of 50% by April 30th, a remediation plan will be required. The assigned DSCC liaison will contact the agency with notification of noncompliance and provide a remediation template. The agency's remediation plan will be due to DSCC within 30 days of the formal noncompliance notification. There are several remediation requirements which must be successfully met if your agency is not at that 50% mark yet. First, remediation agencies must provide documented proof they reviewed and analyzed their agency's EBV compliance data to identify opportunities for improvement. All agencies are responsible for independently monitoring their EBV reporting data to ensure that compliance. Data is provided via monthly reports, and real-time data is available via the HHAeXchange portal. Remediation agencies must review and update their EBV policy for opportunities for improvement based off compliance barriers and provide an updated copy to DSCC. Agency staff tied to shifts non-compliant with EBV standards must be retrained and/or disciplined. If needed, the agency must request technical assistance via HHAeXchange or their third-party vendor if applicable to resolve perceived technical issues that may be impacting compliance. As mentioned earlier in the presentation, agencies not successfully submitting EDI EBV data yet are already required by HFS to be using HHAeXchange directly for EBV until third-party data transmission is achieved. Delays in third-party integration are no longer an acceptable reason for not providing EBV data. Finally, the agency must submit a written remediation plan to DSCC based on their EBV data and identify deficits across EBV compliance components to reach and maintain 50% year-to-date compliance. Failure to submit a remediation plan within 30 days of this notice will result in your agency being placed on hold from serving new DSCC cases. The good news is that remediation is avoidable. Here are some common actions we see by our agencies having already reached the 75% compliance threshold early. First, successful EVV agencies educate. Ensure all staff read and understand your EVV policy and that supervisors understand requirements. Proactively train or retrain staff on EVV requirements, including EVV compliance training and new hire onboarding. Second, ensure accuracy. Participant info must be entered correctly. For example, using the correct RIN number as the member ID found on the 2352 nursing hours approval. Third, verify. Ask questions to clarify EVV requirements. For agencies using EDI, verified data is transmitted correctly to HHAeXchange's aggregation portal and troubleshoot as necessary. Fourth, analyze. Review data provided in monthly reports and real-time data available between those monthly reports via the HHAeXchange portal. Use lessons learned from your progress to update your policy and training as needed. Finally, successful EVV agencies take action. Review EVV data at the branch and individual caregiver level to find specific opportunities for improvement. Provide targeted retraining for habitually non-compliant staff. I'll now hand things over to HHAeXchange to preview some ways you can use reporting data directly within HHAeXchange portal to identify your compliance barriers to work toward improved EVV compliance.
Right, thank you, Kelly. I will take the screen. Okay. Good morning, everybody. My name is Colby Ward. I'm Director of Client Success with HHAeXchange. Appreciate Kelly and the DSCC team for having us here today. As Kelly mentioned, we have a few topics that we're going to cover about how to identify your EVV compliance numbers within HHAeXchange. So this is just an overview of what I will go through today. I'll talk about electronic visit verification and give a little bit of detail about compliance, just building off of what Kelly just presented on. Then I'll talk about compliance reporting within the HHAeXchange portal. I'll also go through how to review compliance by caregiver, as that can be a helpful tool for increasing your compliance over time. And then I have a few resources to share, as well as some FAQs we'll go through at the end. Anything that is within the chat box that folks are wondering about, we can answer some questions live. So first, just a little bit of an overview about EVV, electronic visit verification, and compliance. Starting with the EVV clock in and clock out methods. So electronic visit verification, as I mentioned, otherwise known as EVV, which is what I'll refer to it as throughout the presentation, is the process by which caregivers and or the agency confirms that a visit was performed using electronic tools. In order for that visit to be fully compliant, caregivers can choose from the two EVV methods offered by HHAeXchange. The first is the mobile app. Caregivers can use that application to clock in and out, access the list of their patients, view their schedules should the agency be pre-scheduling, and record duties performed amongst other features within the application. And the second method is telephony or IVR, in which each agency is assigned a unique toll-free number that caregivers will call from using the member's landline to clock in and out. Alternatively, if an agency uses a different EVV system, otherwise referred to as a third-party EVV system, that agency's caregivers will use the tools offered by the other system and then aggregate that data to HHAeXchange. If you do have an alternate system and have not yet integrated it with HHA, I'll ask that you review the EDI process information on our Illinois website. I will have that website link at the end of this presentation when we go through resources. Now just looking at the data elements that are required by the Cures Act, we have, just to simplify it, the 6 W's of Cures Act compliance. And Kelly went through this a little bit on her slide, but I will just build off of this a bit. So these 6 data elements are going to be required for an EVV system to capture in order to consider a visit to be compliant with EVV. HHAeXchange, of course, through the methods that we just talked about, will capture all of these data elements, and the expectation is that a third-party system that is being used and data that's being aggregated to HHAeXchange would need to capture these as well. So first are the who's. Who is the individual receiving the service? And then who is the individual providing the service? Both of those need to be captured for EVV compliance. The next 2 W's are the what and the where. So what is the type of service being performed, and where is the location of the service? Location can be in the home or in the community, as stated previously. And then when. When was the date of the service and when was the time of the service? Those are key elements that are captured as the caregiver performs EVV. Next, I want to talk about understanding EVV compliance. So it's one thing to capture those 6 data elements, but it's another to determine if those data elements are compliant, meaning were they captured at the time of the service, and were there any edits that needed to be made after the fact because the capture was incorrect for any reason. So in order to determine if there was anything that was incorrect during the time of the capture, we use these standards. And then if anything meets these 6 elements, we consider that to be an exception. So what we do is we look for, again, these 7 elements here. Caregiver did not clock in or caregiver did not clock out, or they were missing both a clock in and a clock out. So in that case, the caregiver did not use either the mobile app or telephony, and the agency had to manually confirm that visit was completed. That would be considered an exception. What we're looking for is that the caregiver completes EVV at the time of the service happening and there are no edits that need to be made. So should an agency need to manually confirm, that would be considered an exception in the system. And there are valid cases where that may occur. Someone's phone died potentially, or the member happened to be on the phone at the time that the caregiver entered the home, and so they weren't able to clock in using telephony. There are cases where this occurs, and it's valid to do so in some cases, but we're looking for that to be the exception and not the rule. The next one is temporary caregiver or unknown employee. One of those 6 data elements was actually who is the caregiver. So if that caregiver is unidentified, that would cause an exception on the visit. These next 2 happen infrequently, but they can happen, especially using a third-party system, which is why it's so important to validate that if you are using a system, your data is being captured accurately within the HHAeXchange system. The first one is if you have a visit identified as using telephony, the phone number that the caregiver called from needs to match that of the member's profile. And then if mobile app, the GPS coordinates captured during the clock in and out are outside of that tolerance range of 500 feet. Both of those can cause an exception. And then finally, the one that is potentially causes the most questions is about manual edits. So what happens if a caregiver clocks in early on accident and the agency needs to adjust that? We would consider that to be a manual edit, and that would count as an exception. And the way that we validate that within HHAeXchange is if the visit time, the visit start, and the visit end time do not match the EVV start and the EVV end time. So again, those are the 7 elements that would be counted as exceptions within the HHAeXchange system. And these contribute to the compliance threshold and compliance percentage that Kelly was referencing earlier. Here is the calculation for EVV compliance. So it's looking at, on an overall basis, your total confirmed visits for a given period of time versus your total visits without manual edits. So numerator is compliant EVV visits, denominator is total visits. Below is an example. If you had 130 total visits for a given time period, and out of those 130 visits, 124 had no exceptions, otherwise considered EVV compliant, you would have a compliance percent of 95%. Now that we've talked a little bit about how do we consider visits to have an exception and what is the calculation itself, we want to get into how can you see your compliance within HHAeXchange. Everybody who has a portal should be receiving a report on a monthly basis from HHAeXchange that gives you a point in time compliance percentage. But in between those emailed reports coming to your inbox, you can pull these numbers on an ad hoc basis as frequently as you would like. These reports update every day that I'm about to show you. So first, just looking at the pathway. This is a screenshot of the home screen when you log into HHAeXchange. As a note, both those agencies who are using HHAeXchange for EVV, as well as those using a third-party system, all have a login to HHAeXchange. If for any reason you don't have a login or you're not sure if you have a login, you can reach out to our support team and they can help you get into the system if you have a portal already. Once you're in the portal, up at the top is a report tab, as you can see here on the screen. And then below that or within that is EVV compliance reports. And there's a set of reports there to the right that you will be able to choose from and run on your own. This slide shows an example of what the filter choices look like when you run one of these EVV compliance reports. For the most part, you can leave all of these as defaulted to all, as they're shown here, unless you want to drill into something more specific. Otherwise, the only required fields are your from date and to date, which indicate the visit dates. So you can pull for, a month period of time. You can pull for the whole last year. You could pull for a quarter. However you want to pull that data, you can do so using those from and to dates within the reports. And I'm going to show you an example within the portal as well. The first report I want to highlight is the EVV compliance summary. So that was one of the reports in the options that we just showed from the home screen. This report provides the EVV percent exception based on the payer for that selected date range. So again, you can select your date range. It's going to show you your EVV compliance percent as well as the exception percent, just the inverse of compliance. Who we think should run it would be staff whose responsibilities include monitoring EVV compliance. And then how often should you run it would be, we'd recommend once a week, just to continue to hopefully see trends upward or stability. But it is as frequent as you'd like it, of course. As I mentioned, these reports update every single day. And here's an example of the report after it has been created. So you can see at the top the filters that were selected. The from date is January 1st, 2024, to date January 1st, 2025. So this example is for a year. And as we look down below, you see the payer. So for all of you guys, you would see DSCC as one of your payers. If you work in other programs, you may see other payers listed there as well. And then total visits is all visits within the portal for that payer for that time frame. It could include schedules as well if you are using prior scheduling. Then you have EVV compliant visits. Those are how many visits do not have one of those 7 exceptions that we just talked about previously. Confirmed visits are your total number of visits that have a start and end time in the portal. That includes both those that are EVV compliant as well as those that may have an exception. For example, being manually confirmed by the agency. Billed visits and missed visits, you do not need to be concerned with since billing is not happening out of HHAeXchange at this point, and missed visits are an optional feature that agencies can use if they choose, but they do not have a bearing on EVV compliance %. Visits with exceptions will be, again, those visits that have one of the 7 exception categories that we talked about previously. And then you get into the percentages, as you can see on the right. So your percent of exceptions versus your EVV compliance %, you'll see that those are the inverse of one another. Where you want to be, what you want to hone in on is that EVV compliance percentage, as that is where you need to be above 50% by the end of April. So your EVV compliance percentage, what you are looking for is that reads greater than 50% for DSCC by the end of April. Another report that is within the system that we find extremely useful for agencies is your EVV compliance by caregiver report. This report provides the EVV compliance % based on the caregiver for a selected date range. Again, the folks who we want to run it would be those who are responsible for EVV compliance, and how often, again, would also recommend weekly for this report. Especially when it comes to caregivers, you can pinpoint very quickly when somebody may be misunderstanding or misusing EVV or not using it at all for a given period of time. So this can be a very helpful tool. This is an example of that report after it has been run. What it is going to show you is the caregiver who we have blocked out here just for privacy, but you would see the caregiver's name. You would see their total visits for that period of time, total confirmed visits, and next to that, the EVV compliant visits. And then all the way to the right, you also see that compliance percentage for that caregiver. So this report really allows you to hone in on those specific individuals who may have less than 50% EVV compliance, as those are the ones who are contributing to your overall compliance % being below the threshold that you're looking for. That will give you a list of folks who you may need to either train for the first time if they haven't been trained before, or retrain if they have been trained and aren't following the guidelines to use EVV appropriately. I'm going to pause here and stop sharing for just a moment and then reshare with the portal. I want to show you what this looks like within HHAeXchange itself, and then I will come back to the presentation. On my screen, you should see the HHAeXchange homepage. I just wanted to show that navigation here again within the portal so that everyone can see it. This is the homepage, the landing page after I've logged in. Up at the top is that report menu. And within the report menu is the EVV compliance reports. Right here is that EVV compliance by caregiver report. And down at the bottom is the EVV compliance summary report. So those are the two reports that we just highlighted there. When I click on the EVV compliance summary report, that pops up this filter box that we talked about, where you can select a date range to run the report. Once you've put in your filters here, I'll just select a date range here. I can click generate report. Oops, excuse me, view report. Sorry about that. And that report will pop up with those numbers that we just talked about. So for me, I have a list of payers, and then over to the right-hand side, as I scroll over, I see my compliance percent per payer. So that is how you would run the report in the HHAeXchange system. That is the exact same way you'll run it if you are looking to run the compliance by caregiver report. It looks like I will need to log back in, but you would run it that way. You would come in here and hit EVV compliance by caregiver. That will open up that filter pane where then you can apply your filters and view the report. Once again, I'm going to go back over to the presentation. One moment. Okay, and now I'm just going to highlight a couple of resources that we have available for you. First is the client support portal. Kelly mentioned this during her presentation that you can always contact the HHAeXchange technical support if you have any issues with navigating within the portal, running the reports, accessing the portal, etc. The client support portal link is on this slide. And from here, you would select technical customer care, which is the upper left-hand box. That brings you to our general support line. Otherwise, if you have a third-party system and you have questions about your integration, you would select provider EDI integrations on the upper right-hand side. We also have a list of resources on this slide that include the State Info Hub, which is where we keep all of the relevant information about the implementation of EVV in the state of Illinois. In that, we have an FAQ specific to compliance under the EVV compliance section. As I mentioned earlier, we also have an EDI process tab in there where you can get information about connecting your third party to HHAeXchange. I also have the link again to the client support portal. We have an email address that you can send support requests to as well listed here, and then a phone line that is specific to Illinois. I also have listed on the other side the email addresses for both DSCC and HFS should you have any policy related EVV questions. You would direct those there. At this time, I will turn it over to, I believe, Kelly. We can go through some questions if we have any that we'd like to address at this time.
Thank you. I think we have been addressing some of these in the chat as we go. I did have one pop up in the comment section. If we are unable to locate a patient on HHAeXchange portal, who do we reach out to in order to get missing patients loaded into the system?
So if you are missing a patient in HHAeXchange, you're actually able to enter that patient information yourself within the portal. I can just briefly show that here. One moment.
Colby, this is Emily with HFS. While you're working to pull that up, I just want to encourage providers to verify Medicaid or recipient identification number through the HFS Medi system, just to confirm that they're using the correct Medicaid ID for that individual.
That's a great reminder, Emily. And those also come at the top of the nursing hours 2352. All agencies have to have on file to provide services. Those rarely change, but sometimes do, dependent on things like adoptions, et cetera. So it's important to check both.
Yes, very good point. So if you're missing a patient completely from your portal, that is actually the role of the agency to add the patient and select the contract to create the placement. So what you will do is you'll go to patient, new patient. That will pop up a form where you can enter all of the patient details. As Emily stated, it is very critical to ensure that you enter the correct Medicaid ID. This is how we make the connection between DSCC and your portal to ensure that your EVV information can be shared with DSCC. So ensure that when you fill out a new patient form that you enter the correct Medicaid ID. Just for the sake of time, I'm not going to enter the full profile. I'll just show you the second step. So after you've entered your patient information and selected save to create a profile, you will be automatically sent to their profile. I'm just going to find one who is already created. Within the patient's profile, which you would be directed to right after you create them, there is a tab here for contracts where you would select the contract, add the contract for DSCC. So I don't have DSCC obviously in this demo portal, but you would see DSCC as an option for your contracts. You would add that contract, and that will then allow the process to of the portal to try to link that member to the DSCC portal so that your data can be shared between yourself and DSCC. So that is how you would add a new patient to the portal. Again, if the Medicaid ID is incorrect, the system will not be able to make that link. So it is very critical that that information is correct.
Okay, we have another question in the comments. Please place those in the Q&A if possible so that it's easier for us to make sure we answer all of them. It is, how often is the EVV data submitted from the third party to HHAeXchange, and how often does HHAeXchange submit the data to DSCC, please? As far as the third-party provider goes, if you are choosing to work with a third-party provider, it would be your responsibility to go back and communicate with them about the frequency of transmission. And then I'll defer to Colby and Heather as far as the HHA updating piece.
Sure. So when the data is submitted to HHAeXchange and loaded into your provider portal, that information is automatically shared real time with DSCC over to the payer portal for the calendar view of the member profile. From a reporting standpoint, that gets updated every day. So if you submitted data today to DSCC, that will show up on their reports starting tomorrow.
Okay, that's it in the comments and in the Q&A. It appears there's one more. Hello, does the nurse complete submit their notes on HHAeXchange? No, that's completely separate. HHAeXchange is only for the EVV component piece unless you are choosing to use it for something else, and that does not include nurse documentation. All right, and we are approaching the end of the webinar time. So at this point, anything else in the Q&A, we are going to grab that information and answer via an FAQ after this meeting. All right. So I want to thank everyone for their time today. As we mentioned at the head of the presentation, there is going to be a recording of this sent out so that you can review it if it's helpful as you're looking at your reports. And from there, we will also include that FAQ along with the slides, which have links to several of the resources which have all been sent out. So we appreciate everyone's time today. If you have any further questions, please reach out to your liaison or the 0365 DSCC EVV email also listed in the presentation.